Good afternoon, everyone. Welcome to today's webinar, a conversation with the CDC on school homelessness and COVID-19. Next slide, please. Just a little bit of housekeeping before we get going today. If you have a comment or a question, please do enter them in the questions pane and click send, and then we will all be able to see them. There's just a short PowerPoint that goes with today's presentation, so that is available currently in your handouts panel. We do record and archive the webinar, so that will be on our website shortly at the link that's on the slide here. And if you have signed up for the webinar, you'll get a link to the recording automatically after the webinar is over. Next slide, please. For those of you who are new to Schoolhouse Connection, we are a national organization working to overcome homelessness through education. We provide strategic advocacy at the federal and state level and also engage in practical assistance with our partners around the country. Lots more information is on our website, including a lot of materials related to COVID-19 and a COVID-19 Q&A as well. Our presenters today, we are very excited and very honored to have two presenters from the CDC in Atlanta joining us today, Emily and Neha, really bringing together homelessness and schooling in a way that really hasn't been done, and which is the network that we're all a part of and really focused on. So we're thrilled to have them. Also thrilled to have Erin Patterson, Schoolhouse Connections Director of Education Initiatives. And I didn't introduce myself. I am the Executive Director of Schoolhouse Connection, Barbara Duffield. Next slide, please. So what we did for this webinar, it's going to be a little bit different than other webinars that we've done before. We asked in a couple different varieties through our e-news, on our website, on our Facebook, for questions in advance so that Neha and Emily could see some of the issue areas, some of the questions, and we gave them to them in advance so they could respond to them. They'll let you know a little bit more about some of the areas that they don't have, for which there aren't answers yet, for which they may need to go back to subject matter experts and then get back to us. But what we thought we would do is turn it over to them to have them respond to some of the questions that we did get in advance, and then turn over more into an open discussion where it may be as much the questions that can be answered, we can try to answer, and those that can't, we can get back to you, but then also to help inform future guidance. So really thinking about this also as a listening session about some of the issues and the challenges that you're seeing so that perhaps in future guidance they can be addressed. So with that, I'm going to turn it over to you.
Thank you, Barbara. Hi, everybody. My name is Neha Cramer, and I'm a health scientist here at CDC, and I currently lead the schools unit within our Community Interventions and Critical Populations Task Force for the COVID-19 response. So today, I'm very pleased to be going over a broad overview of CDC's role and what our agency provides as it relates to COVID-19. Share some of the latest data and statistics relating to COVID-19 among school-aged children, and as Barbara mentioned, answer a few of your questions after our presentations. So to start, CDC is responding to the COVID-19 pandemic through a few ways. The first is preparing healthcare providers and health systems, first responders, law enforcement, and public services. Learning more about how the disease spreads and affects people and communities, conducting surveillance, research, and analyzing data, publishing the results of COVID-19 outbreak investigations and other research findings in CDC's Morbidity and Mortality Weekly Report and various other journals, advising and providing guidance for businesses, communities, and schools, protecting the health of travelers and communities in a globally mobile world, spreading the word about COVID-19 and our guidance through a variety of communications resources that can be used by state and local governments and community organizations to support their own responses to the pandemic. And lastly, ensuring that COVID-19 print resources are available in languages commonly spoken by these populations. Specifically, the schools unit that I lead, we primarily develop guidance on mitigation measures or strategies for K through 12 schools, child care centers, and institutes of higher education can use, along with tools and resources for these groups. So on to the latest data and statistics. Several studies have shown that K-12 schools do not appear to be the main drivers of community transmission of COVID-19. First, children are not the group with the highest prevalence of COVID-19 infections. And second, accelerations in transmission among children in schools or school reopenings do not appear to predate surges in community transmission. So for all of us, it's not about school reopening or not reopening, it's about when and how. Success in preventing COVID-19 in schools is connected to preventing transmission in communities. Schools and communities need to implement and adhere to multiple mitigation strategies and adjust them as needed to reduce COVID-19 disease risk for students, teachers, school staff, families, and the community. In areas of low or moderate community transmission, the spread of COVID-19 infection in schools is low when consistent use of layered mitigation strategies is in place. An MMWR study reporting on cases among school-aged children reported that from early March until about mid-September 2020, more than 250,000 school-aged children tested positive for COVID-19, and the rate of confirmed COVID-19 cases among adolescents aged 12 to 17 years old was approximately twice that of younger children who were aged 5 to 11 years old. So this suggests that young adults might be playing an increasingly important role in community transmission. The amount of testing and percent positive tests among children aged 5 to 17 varied over time and by the region. I also want to note, while relatively rare, COVID-19 in children can cause severe outcomes, including hospitalization, ICU admission, and even death. Some children appear to be at an increased risk of severe outcomes from COVID-19, including those with an underlying health condition, Hispanic ethnicity, or Black race. These risk factors are similar to those we see in adult populations. Studies have also shown that in order to enable safer in-person learning, schools and communities should fully implement and strictly adhere to multiple mitigation strategies, especially universal and proper mask wearing, to reduce both school and community COVID-19 incidents to help protect students, teachers, and staff members from COVID-19. So again, it's important to reiterate that success in preventing the introduction and subsequent spread of COVID-19 in schools is connected to and dependent upon preventing transmission in communities. Therefore, it's important that schools and communities implement and adhere to multiple mitigation strategies and adjust mitigation strategies as needed to reduce COVID-19 disease risk for students, teachers, staff, families, and the community. To best control and stop the spread of COVID-19, it's critical to ensure the use of layering of strategies and are put in place and consistently followed. Layering of mitigation strategies includes consistent and correct use of face masks, physical distancing to be spaced at least 6 feet apart, hand hygiene and respiratory etiquette, cleaning and disinfection, and contact tracing to help prevent the spread of COVID-19. To enable schools to open and remain open, it is important to adopt and consistently implement actions to slow the spread of COVID-19, again, both in schools and in the community. This means that all community members, students, families, staff, and teachers should take precautions to protect themselves and others where they live, work, learn, and play. And I do want to let everyone know that we are releasing a scientific brief, hopefully in the next week or so, that will be coming out. And that summarizes a lot of the research to date and data around transmission within schools, and a much more in-depth look at that science and what it says. So please be on the lookout for that. And thank you. With that, I will hand it over to you, Emily.
Sure. Thanks so much, Neha. Thanks so much, Barbara, for inviting us. I'm so glad to be talking with you all, and also hearing from you all because, as Barbara mentioned, the intersection between schooling and homelessness is one where there is space for us to be working and for us to make sure we're covering gaps. So I am Emily Mosites. I'm the unit lead for the homelessness unit in the CDC COVID-19 response. I want to go over just a couple things. I'm going to shift from what Neha was talking about. She was giving lots of good information about schools, and shift to the homelessness side. So overall, when we're looking at COVID-19 cases in the United States, what we saw through December and into January was that over the holidays, we had a very steep increase in cases overall in the general population that has started to come back down. So thank goodness, we are seeing a decrease in cases generally. When we're looking at cases among people experiencing homelessness, we have indicators for numbers of outbreaks that are reported in the media, and we have seen a stabilization. We saw a rise with the general population numbers and then a stabilization of those numbers, and we're waiting for that to come back down. So ideally, we will be seeing a similar trend, and we'll see numbers starting to come back down for people experiencing homelessness as well. In more positive news, there have been almost 34 million doses of vaccine that have been rolled out. I know there have been a few stumbling blocks as vaccination has been vaccines have started to be distributed. We do know that vaccination for people experiencing homelessness specifically has also started in a number of jurisdictions, and I can talk a little bit about vaccine in a moment, and I know we have a couple questions about that too, so we can talk about that a little bit more later. So I want to talk a little bit about what our unit does. We sit in a group called the critical populations side of the COVID-19 response, and we focus specifically on issues related to homelessness and preventing COVID-19 among people experiencing homelessness. That means we write guidance that's up on the website for how to stop the spread of COVID-19 in homeless shelters and other homeless service sites and in encampments. We also provide technical assistance if there's an outbreak or a problem, an issue in the field, in the jurisdiction. We are on the phone to help support science-based responses to those issues. We also collect some data to try to understand the best ways to mitigate risk for people experiencing homelessness. So we're doing a lot of things, and we're very available to answer questions. So if you have more questions after this session, I'm very happy to answer those questions and follow up. The last thing I want to talk about quickly before we jump into lots of questions is vaccines. So there's a couple resources on our website related to vaccine. We have an FAQ related to vaccination for people experiencing homelessness. We just posted some implementation guidance specific to reaching people experiencing homelessness. So those are up and available, and I can put a link into the chat box if anybody wants to take a look at those. The primary things that we tend to think about and want to be talking about related to vaccination for people experiencing homelessness are prioritization. This is the question on everyone's mind, no matter what is happening, is when can we get the vaccine? When can the people that we're serving get the vaccine? And that's really different based on where you are. It's also very fluid. So it's been changing over the past several weeks, past couple months, where people fall in terms of when they can get the vaccine. So it's important to keep a close eye on those prioritization plans and where the people that you're serving, the students that you're serving, might fall in that prioritization. The second thing we think a lot about is vaccine confidence. Vaccine confidence is critical. We can't have a successful vaccine distribution if people do not believe that this vaccine is something they should take. So that means that it's all hands on deck for this. We need everyone to be involved in vaccine confidence work. That means making sure that you are informed in terms of what are the facts about the vaccine, making sure that you're able and willing to get it as soon as you can, and then sharing that information and sharing your experience with the people that you serve so that they can see that as an example and you all are someone that they trust. So that's a very important means of getting information out there to people and making sure that we can have this distribution reach as many people as possible. And then the last thing that we think about specifically related to homelessness and vaccination for COVID is how to reach people. And this is a similar concept. It can be hard to reach people experiencing homelessness with a first dose. It might be hard to reach them with a second dose. In particular, that follow-up, making sure we have contact information, making sure we know where people are going to be and how we can reach them again. That's another way that you all in your roles can potentially be incredibly helpful to the health department as they are trying to roll this out. For families who are experiencing homelessness, for some students who are older, who might be able to get the vaccine. So you all do have a potential role to play in this. And I know that there are a couple questions on this, so I'd be happy to answer those as we get to them. And with that, I will turn it over back to Barbara and maybe we can get started.
Okay, so one just piece of clarification too is in our world, homeless means children and youth who are in motels as well as in shelters and campgrounds, but also a large group of families and youth who are staying with other people temporarily, who aren't. So, one kind of before we get into some of the other questions is just in terms of when we know the rate of transmission and whatnot within the homeless population, sort of is that like the HUD shelters and encampments, or is that, is there any data, I guess, on the broader definition of homelessness and how is that tracked? Just because I know that that's got to be a question on everyone's mind. So just to kind of clarify our definitions right up front.
Yeah, I'm so glad you asked that. That's a really great question. So we don't have very good data overall related to COVID-19 and homelessness by any definition. And the reason for that is a lot of times the primary way that COVID-19 cases are recorded is from a laboratory result and potentially with information from a medical record. And in neither one of those does it say whether or not the person is experiencing homelessness a lot of times. So what we use other indicators to give us a trend. So that means it's a bit imprecise. So what we use when we're talking about outbreaks is normally shelter and congregate setting based. So it's a very good point that that's not the kind of thing that's going to capture people who are doubled up or people who are staying in motels or hotels. It will capture, potentially a family shelter or something along those lines, or other type of congregate settings. The other indicator that we use is there's a discharge code for homelessness in medical records, and we can follow some of that information. That code doesn't necessarily track with either the HUD or the Department of Education definition for homelessness. So what it means is a little unclear, but it gives us kind of a blunt measure of what's happening. And I would expect that that's primarily going to capture adults who are visiting the emergency department. So we don't have a very precise measure. We're kind of getting at it from a couple of different angles, but I really appreciate your point that we're talking about this expanded definition.
Yeah, we'll just always start with that particular item since in the school context, it's a little bit different. So maybe what we can do now is go through the pre-submitted questions, if that's okay, and then Erin will be scanning and you all can scan as well for other questions that may come up in just the larger discussion around issues and concerns and questions. So first question, what can a school staff member do when they find other school staff not wearing a mask within the building? People seem to think if they're alone in a room or 6 feet from other staff, they don't need to be masked.
Yeah, I can take that one. and I think what the main thing we can say here is really just to work with your school administrators to make this a priority and properly message to staff members, that masks should be worn in addition to staying at least 6 feet apart, especially when you're indoors, and especially when you're around people, who don't live in your household. COVID-19 particles are spread between people more readily indoors than outdoors, and it's mainly transmitted through respiratory droplets. So in addition to school administrators and working with them and making this a priority, and working to help message this, there's a slide at the end of this presentation listed with our resources. And if you go to our pages, we have a ton of printable posters and items that you can print out and post throughout your school, and hopefully that will help kind of get the message across for staff.
Great, and that may be somewhat related into this second question, which is about this sort of tension between parents wanting kids back in school versus the safety measures, and we see that is a kind of tension that's pretty broad across the country. And so media campaigns sharing facts, statistics, will those also be part of what's on the CDC resources?
Yeah, in terms of an actual media campaign, I don't know, to my knowledge, that we have something formal like that. But yeah, if you go to our website, there will be lots of things with all the facts and information and talking points and things. The other thing I wanted to point out was that the Coronavirus Ad Council, they have many media campaigns that maybe, and I'll drop the website in the chat here after this, and send it to you too, Barbara, if you want to disseminate. But if you go there, they have a parent-targeted brief with helpful messaging towards parents, and other helpful media campaigns that you might want to check out. And Emily, feel free to chime in if you know any more information.
Great, that'll be great to have that link. Next question: if schools do go back in-person lessons full time, what protections do families have to force the school to allow their students to stay virtual if there's a medical need, either of the student or of a vulnerable family member in the home?
Yeah, so unfortunately, the legal aspect of that question is a little bit outside of CDC scope. In our school's guidance, though, we do recommend that school administrators do offer virtual instruction to those students that are vulnerable themselves or care for someone that is vulnerable. Unfortunately, all CDC can do is provide that guidance and recommendation. Whether a school follows that is up to the local jurisdiction or school district.
Yeah, we definitely have a lot of state and local and federal stuff coming together. Go ahead, Emily. I didn't mean to cut you off.
No, I was just going to say, I think it's worth probably clarifying that CDC is, in general, a non-regulatory agency. So we provide scientific guidance that can inform potential regulations on the state or local level, but CDC itself does not enforce regulations.
Great. Next slide, please. We've got some more questions in the queue before we open it up. We have students who are in multi-generational housing, living with grandparents, even great parents. Are schools open for in-person learning? The students have high amount of anxiety that they could bring COVID home and thereby harm older family members. Do you have any suggestions beyond wearing a mask indoors, which might be unlikely, practicing good hand washing, etc.?
Yeah, so the first thing that I like to do is just point out that we do have guidance for large or extended families living in the same house, and I've provided a link to that guidance on our resources page. So, please take a look at that. But generally, just keep children healthy by teaching them how to protect themselves and others, washing hands often, limit playing with other kids from other households. And if they do play with other children from other households, to keep it outside and wear masks. as feasible. Help children stay connected through video chats, phone calls, help them cope with stress. And we have resources on all those things that I believe I included on that slide. To protect family members at an increased risk of for severe illness from COVID, all family members within the household should act as if they're all at an increased risk. So, other than going to school, to stay at home as much as possible, physically distance, keep social distancing, continue cleaning and frequently touch surfaces, avoid sharing objects and food, things like that. And again, I do want to reiterate that we do have a recommendation that school administrators offer virtual instruction for those who are vulnerable or live with a vulnerable family member. But and also, if someone wants to do a virtual option, that should be an option too. And again, we have resources on coping with stress, talking with children, talking to them about COVID. So please, after this, check out our resources page and check those pages out.
Thank you. And I may add too, Sesame Street has done a lot of great work and resources too around trauma and around COVID-19 in particular. So we can add some of those in too. Next question is back to the vaccine question, and specifically now about McKinney-Vento students. And in our world, we are working from birth. This webinar is particularly K-12, but we're really talking about birth through post-secondary, so like 0 to age 24. And obviously, vaccines come out for different ages and different stages. But the questions about McKinney-Vento students, when they'll get the vaccine, can they get higher priority on the list when there is a vaccine available for the younger children?
So I can speak a little bit to that question. So when we're talking about younger children, right now, the vaccine trials did not include children, the initial vaccine trials for the 2 mRNA vaccines that are available right now. The Pfizer vaccine is available for people who are 16 and older, and the Moderna vaccine is available for people who are 18 and older. So they're in the older age range that's covered. Absolutely, there could be some individuals that can potentially get vaccinated. In terms of those younger age groups, they are now doing trials to get data for younger children, but it's going to be some time before we get that information. So, and I don't really have a prediction on when that will be, but I would expect that we will be focusing for a while on the older ages. So in terms of those older age categories, the types of there's a couple different ways that people are prioritized for vaccine. And one is for their severity of illness, if they were to get COVID-19, and the other is for whether or not they're very likely to get COVID-19. So the age categorizations that's because of the older ages being more likely to have severe disease. So that's why we're mostly starting with these older age categories, because older age groups are more likely to have severe disease and more likely to die from COVID-19. So in that respect, it's going to take some time before we get to a space where young adults and older teenagers are prioritized for vaccination. However, that said, there are potentially other characteristics that might lead individuals to be prioritized early. And one of those is living in a congregate setting. So for those students who are living in congregate settings, there is a potential that they might be prioritized earlier in state plans because of that. So keep a lookout for wording around that from your states. The others are if they have underlying conditions, there's a potential to be prioritized earlier based on underlying conditions. And there was I had a third one, but I don't remember what it was. I'm sure it will come right back to me. But yeah, so keeping in mind these reasons for prioritization can help understand when exactly it might become available for McKinney-Vento students. Because I would say that McKinney-Vento students might not be specifically called out in state plans. And because of that, you do want to pay attention to these other characteristics and be in very close communication with your state health departments to understand when they might be able to get vaccinated.
Thanks, Emily. And the state priorities, I know states are doing things a little bit differently because, as you mentioned, CDC issues guidance and doesn't sort of like lay down the law. But the conversations are, I imagine, will continue to evolve as we look at risk factors. In other words, even though when we get to a vaccine, there may be a point in time when it is a good point to be talking about highly mobile kids who are going from place to place, McKinney-Vento. So I'm just sort of, I guess I'm sort of asking and maybe hoping that state guidance is fluid as well as we learn. And so there's an opportunity for advocating, in other words, for people at the local level with the state health department about McKinney-Vento prioritization.
Yes, I would say that the state level prioritizations are fluid, and they're evolving and they'll continue to evolve. The CDC prioritizations are perhaps a little less fluid, but we're learning that comes from the Advisory Committee on Immunization Practices that makes those recommendations that then are adopted by CDC. But CDC itself is always learning about, what underlying conditions might increase risk, what types of settings are increasing risk. So keeping an eye on CDC guidance will also help kind of understand how we should be prioritizing as well. And I thought of the other element that is an important thing to be thinking about. Some of your students might also have jobs, and some of those jobs might also place them at increased risk for contracting COVID-19, and they may be prioritized through those jobs as well. So that's another thing to be keeping an eye on.
Yeah, thanks very much for mentioning that. I was just talking with our Director of Youth Leadership and Scholarship we have, and all of our scholarship students this year, who are all high school students, are all working 30 hours a week or more and going to high school full time. So it's very, very real scenario to have students experiencing homelessness who are working in those essential worker type job categories. And of course, their parents as well, for those who are with their families. All right, we have one more slide of sort of the pre-submitted questions, and then we'll turn to our questions panes. What strategies are being considered to reach and inform non-English speaking families of available resources and emergency procedures?
Yeah, and thank you for this question because it got me thinking a little bit. My unit in particular, the schools unit, I don't know of any specific concrete outreach strategies that CDC is doing. There might be another group, but when this question came in, it put it on my to-do list to start to figuring out. But we do have resources on the web, and I include that on our slide as well, for online resources in other languages. CDC website can also be turned into Spanish, so we do have that. But this was a great question, more to inform myself. So I apologize, I don't have a very good answer for you, but I don't know, Emily, if you had any other insight or thoughts.
No, yeah, that's it's a really great question, and I know that there are some resources in the communications section of the website, but otherwise I don't have any specific outreach examples.
So this is I'm glad we're having the conversation again. Part of today's purpose is to sort of surface these issues and for future guidance or future resources, or even learning what other people might be doing about this. The next question, I've read some articles that suggest wearing a mask and social distancing should continue after receiving the vaccine. If school staff and students begin receiving the vaccine, how long will staff and students be required to wear a mask and social distance in school buildings?
Yeah, so Emily touched upon this in an earlier question already. The Pfizer vaccine is approved for persons aged 16 or older, and the Moderna, I believe, is 18 years or older. So, students may not be vaccinated for a while. And again, we can't give a particular date at this time, but the vaccines provide immunity to the individual person who is vaccinated. But we don't know yet if the vaccinated person can carry and transmit the virus to others yet. So that's really the reasoning behind continuing wearing face masks even after one has been vaccinated. Of course, as the science evolves and we get more information on that, CDC will certainly re-examine this recommendation and revise as necessary.
Thank you. And Emily, did you have anything to add to that before I move on? No. Okay. McKinney. Oh, go ahead.
I was just going to say just that the same logic applies in shelters as well. So if you're working with students who are staying in shelters, those mitigation measures that have been in place since the beginning are probably going to continue for some time until we get more information on the interruption of transmission based on vaccination.
Thank you. All right, so the second to the last of the prepared questions, McKinney-Vento students move frequently due to no fault of their own. There are no shelters off in many places, and they are at the mercy of other people. How do C guidelines for schools account for these families and youth? For examples, ideas like cohorts, pods, etc., seem to assume that children are staying in the same place.
So I can start with this question, and then I'll turn it over to Neha if she has anything to add. I would love to hear back from you all about this, because one of the things that has happened since the beginning of the pandemic is, yes, people are still moving, but there has been a bit of a decrease in movement itself and policies in place to try to limit movement a little bit. For example, not clearing encampments and the eviction moratorium, trying to just limit movement overall. And I'm curious, have you noticed any changes in terms of overall movement, and has movement decreased, or do you still see the same amount of movement that you had seen before? And then in terms of strategies for these students that are potentially moving around a lot, I know that they're supposed to stay at the same school, and that's a big component of the McKinney-Vento Act, right? So, and I know that schools have had a number of changes in terms of how they have some availability for some students to come in sometimes. And I know that shelters have also put some of that in place, that some shelters have set up e-learning for students so they can come to the same place and do their schooling or do virtual schooling from the same place. I wonder if those strategies are being rolled out and how well they're working. And then Neha, I'll hand it over to you if you have anything to add on that.
Yeah, I don't know that I have anything to add. I think this is a great question, and another question that is great to kind of inform us. You know, as we go to revise our guidance, how do we, you know, incorporate this information for this population into our guidance? So, yeah, hearing from you all on how we can, you know, better make our guidance for this. You know, cohorting pods, I see that as examples, and I think those are great examples, but fully realizing, you know, not everyone can probably do that with a mobile population. So yeah, definitely things to think about on our end.
Why don't and now as I wish I would have had a poll, interactive poll, so we could ask people like in real time about mobility. So I'm gonna say anecdotally some of what we've heard, and then would love for people to put in the question box your experiences. I think initially for people who are staying with other people, we've heard the concern, and if they were also working essential jobs, would get kicked out because of fear of bringing COVID back. And particularly for our youth who are homeless on their own, staying with other people, fear of COVID would lead to them being kind of kicked out, so that the doubled up population, at least initially, there was some mobility as concerns around COVID and shared living situations where you can't do like head to toe bunks, on someone's living room. But at the same time, and again, this is anecdotal through surveys, in some places where there have been eviction moratoria for those who are staying with people who are protected, that may cut. So I would be curious to see. All right, here's a couple things. This is good. This is real time. We haven't done a webinar quite like this, so I'm kind of excited about this. So families are still moving, especially if one person is doubled up becomes COVID positive. So, and then another saying, correct. So I guess that's correct what I'm saying about youth in particular, and others who are moved, who are kicked out. And if anybody else wants to share now, sort of, we'll take these two pieces. It's first the question of kind of what's the mobility look like for our McKinney-Vento population right now, and then the second one being about how school of origin might be helping. So again, for those of you who are not McKinney-Vento fluent, we know that under McKinney-Vento, children and youth who are homeless have the right to stay in the same school if it's in their best interest, and get transportation there, and that schools are required to do individualized, look at that individually and take into account all sorts of factors, but also prioritize the wishes of the parents or guardians. So school stability is a cornerstone of what we do in McKinney-Vento, because school stability is larger stability in both socially, emotionally, and also for academic success. But looking at that in the context of COVID may be different too. Here's other comments. We've actually had more movement due to job loss doubling up. Another comment, I've seen data from Southern Nevada that showed evictions this November 19 compared to 2020, there were twice as many as in November 2020. Another liaison, I'm getting calls daily of children losing their parents or guardians to COVID. Erin, you want to read the next one?
Yep, just taking myself on mute. So just picking up where Barbara left off, and they're coming in so fast now that my scroll bar is moving. I'm seeing McKinney-Vento students are still very mobile because they are learning virtually, and they're able to stay in their school of origin that way. So that's an interesting perspective that's happening there. Some anecdotes here about school being designated in a yellow zone, but prior to that, the school had made arrangements for special cases, which included those in temporary housing, and so they were in the building twice a week. And it was more than 10% of that population, and this was after a lot of correspondence with families. We're getting a lot of anecdotes like this come in now. And so if it would be helpful, we can compile these and share those back, because I think it's going to be too many for us to read through in the moment. But I think folks are underscoring this idea that we're actually still seeing a lot of mobility among students and families experiencing homelessness right now.
Thank you so much. Thanks everyone for participating. That's really helpful to hear and helpful for us to be thinking through in terms of what types of strategies we should be thinking about for these students.
Yeah, this is extremely helpful. So for those of you who are entering, please keep entering, because again, the more information we have from the real world, the better our guidance is. When I say all guidance, I mean federal and nonprofit, as well as advocacy. Again, and seeing more about children moving in with grandparents due to parents becoming homeless. So this is really super helpful. And I think, there was just one more I wanted to read specifically about school of origin, if I could find. School of origin helpful if students are in buildings. There are more communities where students are not able to attend in buildings. And I'll just comment there that some of the questions that we've gotten are about sort of school of origin in a virtual setting. And again, McKinney-Vento is in place. It hasn't been altered. It's fully in effect. So that does mean it can be beneficial for students who do get displaced, who can keep their online learning the same. So even without it's obviously, most helpful if we're in person, but it can be very helpful in this virtual scenario as well. So a lot of what we've done is try, and by we here, I'm talking about like the global homeless education community, is, how do you implement, McKinney-Vento's in place, how do you implement in these very different different scenarios. So last question has to do, and I know this is a very hot topic, and so not something you're going to be able to give an answer to, but I'll just, since it was one, is about about educators getting the COVID vaccine 19 prior to reopening. And I imagine this too gets into some of the state level policies as well.
Yeah, so the advisory committee on immunization practices, I believe, has educators or the education workforce in phase 1B. But yeah, each state usually has its own plans. They can either follow those recommendations strictly, or they can change it however they see fit for their state. But yeah, I would, that is something that CDC has started making a priority in terms of messaging that we really need educators vaccinated, for sure. But ultimately, unfortunately, or fortunately, I guess it could go either way, but that does fall to the state to ensure vaccination for the education workforce.
Thank you. Okay, I think the next slide is what we tried to do here with the next slide is just sort of look at some of the general categories. And we thought this would be sort of like good for open discussion too, in terms of questions that we've gotten or things that are on people's mind. And there are actually already some questions already on this. And I don't know, Erin, if you've flagged a couple of these that fall in, good, you have, around these broad categories of testing, in terms of the testing that's available for parents and for students, the vaccine distribution, school safety, distance learning, and other areas. So again, just for our audience, knowing that Neha and Emily may not be able to give immediate answers, but to raise some of these issues. So I guess at this point, flagging issues, flagging concerns, and flagging questions. And Erin, go ahead, I'll let you read some of the ones that have come in.
Yeah, we've seen a couple questions and have some energy around the vaccine requirements and process. And so I'm wondering if you could help clarify so that our state coordinators and local liaisons who are working directly with families and unaccompanied homeless youth in particular can help translate the information. So one question is for unaccompanied homeless youth, of which we know there are millions. But for unaccompanied homeless youth who are age eligible for a vaccine, what are the requirements, documentation in order to sign up for and receive the vaccine? And then the same question, but for immigrant families.
So actually, this is something that we're about to update our FAQs regarding documentation, because this is a concern related to homelessness broadly, and of course, migrant families, as you mentioned. So the information that's needed is going to be, it's very basic: name, date of birth, sex, and address. Address, of course, is a little complicated. We recommend using the address field as an indicator for homelessness, or as the organization where a person might be staying, so that we can track vaccination among people experiencing homelessness. So it's actually a very small set of information that's required. That information is needed for follow-up for a second dose. And some information is transmitted back to CDC just for tracking purposes, non-identifiable. So documentation that a person needs to bring to the site really would not be anything at all in terms of those basic pieces. There are differences, of course, by state and by the administrator of the vaccine itself. So there might be some variability in terms of what people are asking for in terms of getting a vaccination. But we are putting out an FAQ that's going to say, for people experiencing homelessness specifically, we want to make sure we do not have a lot of documentation or any documentation requirements to get a vaccine, just those couple pieces of information so we can track for the second dose.
Great.
That's super helpful.
There was, I need to find it now, a question. Hold on. There was a true false question. There was a question. Do you see it? Do you see it, Erin? Okay, good.
Yeah, I like this a lot. There's sort of a myth versus fact. And I noticed one about antibodies. And if we're thinking about returning to school and if a teacher or a student has had and recovered from COVID, is it true or is it false that they cannot get COVID again?
So, so right now, the information that we know, what the science is showing, is that you are very, very unlikely to get reinfected for up to 6 months. That's what our data and science shows right now. It could be longer as you know, we go further into this, and as we know more information. So I that's both kind of true and false in a sense.
Yeah, it's reinfection has occurred, and we know that it has occurred, but it is very rare. So the expectation is that there should be several months where a person who has had COVID is unlikely to get COVID again during that time.
Yeah, I might. Sorry, I was just going to add the variants. You know, we don't know a whole lot about the variants yet, and what that means if you've been infected once, and how the variants are going to affect that. If you could get infected with a new variant, so on and so forth. So I think right now that we are surveilling that data and looking at the science there too.
That's helpful. And then the same question was posed about the vaccine. Is it true or false that once you get the vaccine that you cannot get or pass COVID along?
So I think the vaccine has a 95%, what is it called? Emily, help me out here. Effectiveness rate, is that what it would call? Efficacy. So that's pretty high for a vaccine. That does not mean you couldn't get infected. And again, with the variants here, some of those the different vaccines coming out may or may not protect as greatly against some of the variants.
So the one of the concerns right now, and part of like what Neha had mentioned earlier, part of the reason that we have to continue using mitigation measures like masks and distancing is because the trials evaluated whether or not the vaccine prevented disease from COVID-19, symptomatic illness. They didn't evaluate whether or not you could still get infected and potentially pass on SARS-CoV-2, the virus. So that's what we don't have data on yet. So it's unclear right now if you can get the vaccine but still be infected. The vaccine, however, has very high efficacy, 95% efficacy. The 2 mRNA vaccines, at least 95% efficacy for or against symptomatic disease.
Here's one, and this is, I think, gets at some of the tensions too on all of this, which is when balancing the mental health of students being isolated, living doubled up, and schools typically not being places of mass spreading, is there any additional guidance regarding encouraging students to return?
Yeah, in regards to encouraging students to return, so, you know, the data is showing that when schools implement mitigation measures pretty strictly, transmission can be kept very low within the school setting. You know, a lot of that is also attributable to what's going on in the community. So, of course, the higher the transmission is in the community, the more likely someone is to walk into the school with COVID. A lot of our messaging is starting to shift that schools should be the first to open and last to close. But the community really needs to play its part in helping to slow the spread of this disease. So I don't know if that answers your question, but that is what the data is showing now.
That's helpful.
We had a question earlier that I think you addressed, but just to say it again and then add on my own question. It was about sort of data on COVID infection rates for different age groups, pre-K, K-12, and post-secondary. So wanted to throw that out there and let you address that or readdress that, but particularly for childcare providers, pre-K programs, Head Start programs who are considering reopening and how to reopen, given that children are not vaccine eligible. What might you say to those programs when considering reopening plans?
Yeah, so yeah, thanks for bringing that up. And yeah, another part of what the data is showing is that younger students or younger children, usually less than 10 years old, are less susceptible. They're less likely to have severe illness, and some of the data is showing that they're less likely to if they are infected, to spread it, versus middle and high school age children. That may be just the nature of what those age groups do. They're more likely to be out in the community, hanging out with each other. They have sports, things like that. So we don't know quite what exactly the differences might be, but you can kind of make your own assumptions. In terms of reopening, and we should be having updated childcare guidance out very, very soon, hopefully the end of this week or next week. So keep on the lookout with that, and we'll also have tools and resources to go along with that. But yeah, I think the same principles really apply. Wearing your mask, and I realize a lot of these things, especially in a childcare environment, such as keeping distance, things like that, are not really a realistic option, especially for childcare providers. But to the extent possible, to keep your distance, wear your masks, and otherwise continue routine cleaning. We are moving away from, emphasizing disinfection now that the science has evolved and we've gotten a lot more information that is not the primary driver. Touching surfaces and the surface harboring the virus is not the main mode of how we're getting infected. So yeah, I think I would just really stress those key mitigation measures, and of course, once a childcare provider or educator can get vaccinated, to really encourage that, because I've also heard anecdotally that in some communities the educators don't want to get vaccinated for whatever reason. They might be scared, or they've heard misinformation about it. So keeping that in the back of our minds.
Thank you. We are getting this close to time already. So before we do our kind of wrap up here, I just want to, are there points that you've seen, Neha and Emily, either in the chat box or anything else that you want to, actually, next slide, Lakan, I think we'll have the resources. So you can look at the resources and also sort of think about any other pieces that you'd like to address before we wrap up.
Not for me right now. Actually, the questions they're coming up very small, so I haven't been able to actually look at them closely. But I really encourage Barbara and Erin, if you could compile a list of some of those questions, and we can certainly try to get back to you with responses to those that you can disseminate to everybody.
Thank you.
I'm sure, and I just wanted to jump in and say, it looked like there were over 400 people on this call, and I appreciate all of you so much for, still being willing to really be diving in there and advocating for the students that you're working with, and just, taking care of your community. I appreciate your work so much, and so glad to hear from you all. We will certainly be looking into the questions that you've raised here, and happy to answer anything further. Hopefully the resources can be helpful to you, and thanks a lot.
Okay, so next slide is, I think, another page of resources from the CDC. Just want to make sure everybody sees what's there, and also notice that there's something coming soon here in terms of specifically vaccine distribution among people experiencing homelessness for health departments. And then next slide, we've got also some Schoolhouse Connection resources, specifically around identifying students during building closures, keeping in touch with students during the pandemic, since we know that's very challenging, online enrollment, and again, our frequently asked questions, which maybe we'll be able to put some of these on, our frequently asked questions. We have a whole CDC section of our fact document. And then lastly, again, thank you so much. Oh, the four-part series commercial advertisement for engaging and re-engaging students experiencing homelessness. These will be short conversations with practitioners so you can hear from peers about how they're responding in a variety of settings across the country. And very lastly, we have contact information. Neha and Emily have been gracious enough to provide their contact information as well. So thank you very much, everybody, for your time and for your work and for joining us today. We really appreciate it. Thank you.
Thank you.